Okay, so today we'll continue with another lecture on our topics of behavioral science or behavioral science course. So far we have covered ethics and psychology of development, and we've also covered some basic psychological theories, psychoanalysis and behaviorism. Today we'll cover an entirely new topic, which is intelligence, personality, and achievement. And this has to do with the field of psychology that's called psychometrics, and that is to say, how to measure things, how to measure psychological traits. Now, there are many psychological traits to be measured. They can be personality traits, but they can also be intelligence. And U.S. physicians should also be interested in the way psychiatrists measure some of the traits in their patients. So psychology, although it's part of the human sciences or the so-called behavioral sciences or social sciences, and it's usually considered a soft science in comparison, let's say, to physics or chemistry, psychology, out of all the social or human sciences, is probably the one that's closest to a positivist way of thinking. That is to say, a paradigm that tries to measure stuff quantitatively, that is to say with numbers, and not just a mere interpretation. So as a psychologist, you have to gather data, and in order to do so, well, you have to follow some methods, and we'll cover some of those methods here. That is to say, the way that tests are designed in order to recollect data to test intelligence, personality, and achievement. So keep in mind that all this stuff will come up in the US MLE Step 1, and as soon as we finish this lecture, we'll go on to review all the contents that we have covered today by taking a look at some of the answers, or I'm sorry, some of the review questions that are very similar to the ones that have appeared in the USMLE Step 1 in previous editions. Okay, so let's begin by taking a look at the different types of tests that are used in psychology. First of all, there are intelligence, achievement, personality, and psychopathology tests. So intelligence tests, well, they are the ones that measure how intelligent someone is. Now, as we'll see later on, intelligence is a tricky subject because there are some people who think that intelligence is just too complex to be measured, or that at any rate there are many dimensions to intelligence, so it's not so easy to just put them in a test. But nevertheless, there are many psychologists who do think that testing intelligence is possible, so we'll take a look at that a little bit later on. The same goes for achievement. This is more of academic achievement, so there are some tests that are designed to study how well an individual does academically, and to a certain extent, the USMLE Step 1 is a type of achievement test. Now, of course, it's a very specialized type of test. It's just designed for medical students. Achievement test is more generalized, but nevertheless, I mean, you get the idea that the purpose of an achievement test is to gather data about how academically consistent or how academically prepared someone may be. There are also personality tests. These are a little bit more controversial because they're more open to criticism, in as much as they are not as objective as the other tests. So we'll take a look at them later on. And there are also tests that try to measure psychopathology, and trying to get around how normal a patient may be, or how pathological he may be, and what may be some of the disorders that those those symptoms express. So those are the four types of tests that we'll be taking a look at. Now, apart from that, we can also make other divisions of tests. There are objective tests, and these are based on questions that are easily scored. And these are mostly used in intelligence and achievement tests. And there are also projective tests, and these are a little bit different. These are a little bit more used in personality tests. These are tests where the subject interprets questions, so it's a little bit more difficult to have a precise answer as to what is the right or wrong answer. Whereas in objective test, There are more right or wrong questions, so it's easier to figure out what the level of intelligence or achievement with someone is. When it comes to personality, it's a little bit more difficult to do. And when it comes to psychopathology, well, I would say it's somewhere in between. I mean, some items are objective, some other items are more projective. So, you know, it's the middle ground between objectiveness and subjectiveness. We can also divide tests according to how precise they are regarding the individual that takes the test. So there are individual tests, they are more precise, or there are also group tests, and they are less precise, but they're easier to administer. So usually group tests are the ones kind of like the USMLE, when people go into a room and they're given paper and pencil and they have to answer a set of questions. Whereas an individual test, it's the tester sits with the subject and they go through each question, so more attention is given to the individual. The results are expected to be more precise. So individual tests are more precise, group tests are less precise, but they have the advantage that they are easier to administer. Okay, so let's begin by taking a look at intelligence tests. Now, from the beginning, this is a little bit tricky because psychologists do not all agree on what intelligence exactly is. And there are quite a number of controversies regarding this topic because, as we will see, it has some political implications and also some racial implications when it comes to racial relations, not only in America, but also in other countries. But of course, especially in America. Because, as you probably know, race is a much bigger problem in America than in many other countries in the world. In Latin America, race is not as big as a problem, and race relations are a little bit more harmonious than in North America. But for the time being, we'll define intelligence as the ability to understand abstract concepts or reason, to assimilate, recall, analyze, and organize information. So intelligence has to do with cognitive abilities, and that is to say, how does your mind process information? And it's not just about memorizing information, although that may be part of it. It's also about how you process the information. I mean, once you have the information, how can you solve problems? So intelligence can be about facts, about remembering facts, but it can also be about applying those facts to specific situations and reasoning. Now, as I was saying, this is a controversial concept because we're not really sure what intelligence is. And when it comes to intelligence, there are basically two theories in psychology regarding intelligence. First, there are those psychologists who believe that intelligence is a real thing and it's a real unified thing, and that there is such a thing called general intelligence, and that all those intelligence tests, they measure what in psychology is called the G factor. Now, the G factor is supposed to be an underlying capacity that individuals have, and that capacity, that underlying capacity, allows them to succeed in any other area of academic achievement. So the proponents of this G factor theory claim that there is a tendency for people who do well in one area to also do well in another area. So those of you that pass the USMLE, well, it's quite likely that when you were high school students, you were not just good in chemistry or in biology. It's very likely that you were also well behaved, that you had good behavior, good civic behavior, and that also you were good at math and probably at geography or history. Now, of course, I mean, in high schools all over the world, those who get A's in one class, that doesn't necessarily mean that you will get a high grade in another class. I mean, there have been many cases when people get an A in physics and maybe an E in chemistry. But that's usually not the case, or at any rate, the difference is not as big. Because according to this theory, if you do well in one class, well, it's because you have a generalized intelligence that not only allows you to do well in that class, but should also allow you to do well in every other class. And that's called the G factor. So the G factor is generalized intelligence that allows people to exceed, basically, to succeed in all areas of life. Now, this has been disputed by other psychologists who, as opposed to this theory, they propose what's called the multiple intelligence theory. And basically what this theory claims is that intelligence is not just an underlying ability that covers all areas. You may do very well in one area, but that doesn't necessarily mean that you're smart in another area. And according to this theory, there's not just one generalized factor, there's no G factor, but actually there are many intelligences. So this is called multiple intelligence theory. And in their estimation, intelligence can be divided in various dimensions. So first of all, there is a musical rhythmic dimension. So these are people, let's say, like Beethoven or Mozart or Chopin or Michael Jackson or Elvis Presley. These are people who have a great ability to, incorporate sounds and make artistic creations with music, but not necessarily be all that good with numbers or with learning, let's say, neurotransmitters or or things like you physicians have to learn. There's also the visual spatial intelligence. Well, this has to do with the capacity to locate yourself well in space, to not getting lost in a city once you get to know it, in being good with maps and so on. Well, I can tell you I consider myself relatively smart when it comes to some academic issues, but when it comes to visual spatial abilities, I would say my intelligence is quite low. I get lost rather easily when I arrive to a new city. So I don't have a good sense of a spatial location. So again, the G-factor theory would claim that all of this comes together. People with those psychologists who defend the multiple intelligence theory, they claim that not necessarily it all comes together. You may be good in one dimension, but not good in another dimension. There's also verbal linguistic theory. Well, this has to do with how well you communicate with others. Journalists, novelists, professors, and so on are supposed to have a high intelligence when it comes to this dimension. Logical mathematical theory, that has to do with engineering, all the engineering professions, or to an extent people who study chemistry, people who study math, and so on. Bodily kinesthetic intelligence, well, I would say that athletes are covered here. So you may think that someone, I remember that they used to say, for instance, that Shaquille O'Neal was a great basketball player, but he was not all that smart. Well, someone who defends this theory regarding multiple intelligence would say, well, Shaquille O'Neal is very smart when it comes to the bodily kinesthetic dimension. So he should be considered as smart as someone who is really good in the logical mathematical dimension. I mean, intelligence is not just about equations or numbers. It may also be about throwing the ball to a basketball hoop and, making the right parabola so that the basketball goes inside. There's also the interpersonal dimension. This is basically how well you get along with other people. And I think they're quite onto something. I mean, it may be true. Sometimes I encounter people that are very smart when it comes to music, or when it comes to writing an essay, or when it comes to doing a math equation, but they just don't know how to get well with other people. So interpersonality is another dimension. And also intrapersonal and naturalistic. Naturalistic has to do with how you relate to nature and how much you enjoy nature and how much of an ecological conscience you may develop. Well, that's also considered another dimension of intelligence. So people who defend the multiple intelligence theory, they usually point as a fact that one can find people with what used to be called a savant syndrome. Now, the savant syndrome is not part of DSM-5 anymore, but it's usually presented as a mental condition where people may be severely intellectually disabled in some areas, or in most areas, but in some specific areas they have very high intelligence. Now, you've probably seen this movie, Rain Man. This is a movie about a man who is diagnosed as being a savant, and it's the character played by Dustin Hoffman. And his brother, Tom Cruise, is out to look for him, well, because of some family reasons. Now, in their interaction, well, it comes out that Dustin Hoffman's character, he's very limited in intelligence when it comes to interpersonal relationships and other stuff. But when it comes to some very specific dimensions of intelligence, such as calculating very high numbers, like astronomical numbers, or memorizing some specific things, like the names on the yellow pages from the books that are used in telephone companies in order to call people. I mean, most of us don't have the capacity to memorize any of those numbers, and that's why we use cell phones and why we keep contacts in the cell phones. In the movie, he has the capacity to memorize all this stuff. Now, the movie has been criticized a little bit for not being all that realistic. I mean, savants, first of all, they're not all that they're not as frequent in the population, and second of all, they're not necessarily as smart as Dustin Hoffman is presented in this movie. But nevertheless, it's still an acceptable cultural depiction of what savant syndrome is like. And this savant condition is pointed out by the people who defend the multiple intelligence theory as a great example of how you can be smart in one area and not necessarily smart in another area. So that's why they claim that measuring intelligence is a very tricky business, because I mentioned intelligence has many dimensions. And I would say it would be relatively similar to saying how athletic you are. Well, it depends. I mean, you can be very fast, but not necessarily being fast. It's a whole story of being athletic. I mean, you can still be very athletic and not being very fast if, let's say, you're a weightlifter. And if you are going to define being athletic by saying how much weight you can lift, well, that's not necessarily the case, because you can be a great sprinter and not necessarily lift a lot of weights. So there are different athletic abilities, and these psychologists claim that the same goes for different intelligence abilities. I mean, there are many dimensions, and being good in one doesn't necessarily imply that you will be good in another one, or vice versa. Okay, so let's leave that controversy aside for a moment, and let's concentrate on mental age, chronological age, IQ, and the Flynn effect. Now, assuming the G-factor theory, I mean, assuming that there is such a thing as generalized intelligence, psychologists come up with a concept of mental age, and this is a person's level of intellectual functioning. Now, mental age is usually contraposed to chronological age, which is the person's actual age in years. Now, the IQ, which stands for intelligence quotient, is the ratio of the mental age to the chronological age times 100. So an IQ of 100 means that the person's mental and chronological ages are equivalent. Let's say someone has a mental age of a 12-year-old, but they're in fact 10 years old. Well, in that case, it would be 12 divided by 10 times 100. So that would give 120. That person would have an IQ score of 120. And a score of 120 in IQ, it actually means that that person has a proportion from their mental age to their chronicle age as a 12 to 10. There are many versions of the IQ test. We'll look at them later on, but this is what it basically means. Now, one thing that must be kept in mind here is that IQ test scores are have not been stable. And there is something that's called the Flynn effect, and it's named after a psychologist who has studied this a great deal, and he's still alive. The Flynn effect is the fact that global IQ has increased over the years. So someone with a mental age of, let's say, 15 years old today would not be someone with a mental age of 15 years old in the year 1900. I mean, being today 15 years old in mental age would probably be the equivalent of 18 or 19 years old in the year 1900. And that's because overall the human species has increased its IQ. So this is why the concept of mental age is a little bit under scrutiny, because it has not been stable. Someone with any given mental age today would not be considered with that mental age 100 years ago, because today we are smarter. So usually the way this works is that the IQ is set at 100. So 100 is normal intelligence, and it's a correspondence between chronological age and mental age. But we must always keep in mind that mental age is a fluid concept, because today's mental age is not measured as it was 100 years ago, and that is because IQ scores have increased a little, have increased significantly. So that implies that what's average today was not average 100 years ago. So an average score today would be above average if that were placed in the data 100 years ago. So keeping that in mind, let's take a look at some of the bases of IQ. Now, IQ tests have been quite controversial for reasons that we'll cover a little bit later on. But let's keep in mind, or let's take a look at some of the concepts that are related to IQ and the basis of it. I mean, why do people have different IQ results? Well, first of all, there is a genetic base, and this has caused some controversy because there was a very famous, or someone would say rather infamous, book in the United States in the 90s. There was a book that was called The Bell Curve, and this argued that some people are naturally smarter than others because they have higher IQ than others, and that this may even have a racial composition. And the authors of that book claim that some people in some races were smarter than other people, and it doesn't really have anything to do with education, but rather with their genetics. Now, that caused a lot of controversy, and the book has been open to a lot of criticism, and those criticisms are probably right. I mean, that they made a lot of mistakes in their studies, but it is nevertheless a real fact that IQ has a strong genetic basis. Now, the heritability of IQ is about 0.45, whereas for adults it's 0.75. Now, that means that during the first few years of life, well, education and environment may have more of an impact on how variable IQ is when it comes to children. But as they age, people tend to go closer to the IQ of their biological parents. So these have been done with studies with twins. There is a much higher concordance of IQ between identical twins or monozygotic twins than between fraternal twins or dizygotic twins. And there have also been studies comparing twins that have been separated at birth, identical twins that have been separated at birth, and there is actually quite a high incidence, there is a quite high rate of coincidence in their IQ scores even after having been separated at birth. So that suggests that their level of intelligence, or their intelligence quotient, has a strong basis in their genes. Now, having said that, it must also be said that environment plays an important part. So nutrition, education, and health play a significant role. So just because you're born with genes for intelligence, that doesn't mean that you are going to be smart unless you're given good nutrition, good education, and good health. And this is important to keep in mind because some of the people that have had low IQ, they usually also come from groups that have not been given good access to nutrition, education, and health. So when those people have lower scores in IQ, that doesn't necessarily mean that they have genes for lower intelligence. It may also be that it's due to poor social conditions. So it's undeniably true that genetics and environment play a role, and that maybe even genetics have a stronger influence than environment when it comes to intelligence. But let's keep very clear that genetics is not the whole story. Now, apart from that, just as I mentioned in the previous slide, there is also the Flynn effect. And now, in the Flynn effect, as you remember, is that there has been an improvement of intelligence over the last 100 years in the global IQ, in every country. So this suggests something very important. The fact that there has been an increase in IQ over the last 100 years suggests that education plays a significant role. Because how can you explain that the global IQ has increased? Well, you can explain that by natural selection. I mean, there has not been a significant change in the gene pool. Evolution takes a much longer time to work and to change the composition of a gene pool. But there has been dramatic changes for the good in educational and nutritional and sanitary conditions. So, I mean, if you lived in conditions in 1900, they're much poorer in terms of education and health than the conditions that you have in 2017. So those dramatic changes have had a significant influence on an increase of education and I'm sorry, not an increase of education, an increase in intelligence, which comes through an improvement of educational conditions. So the Flynn effect suggests that education plays a significant role when it comes to the development of intelligence, and that it's not just about genetics. Now, when people take the IQ tests, they get scores, and depending on the intelligence ranges, we can tell whether they're normal, whether they are gifted, or whether they have some retardation, or as it's now called, intellectual disability. So, as I was saying, the IQ is set so that 100 is considered to be on par between mental age and chronological age, and someone with a score of 100 is assigned to be normal in terms of intelligence as compared to the rest of people. So if you say a bell curve, well, 100 is usually said to be the mean of the data. If we have chance and we have time to have a lecture on epidemiology and in statistics, we'll go on this a little bit in more detail about how bell curves work. But for now, it's just enough to know that 100 is usually said to be in IQ scores the mean of IQ scores. So someone with 100 has average intelligence. So normal IQ is in the range between 90 and 109. And of course, 100 is right there in the middle. Now, less than 70, which I think are 2 standard deviations on the inferior side from the mean. Less than 70, that's considered mental retardation. Now, within the range of mental retardation, there can also be various levels. Now, mild retardation is between 50 and 70. Moderate retardation is between 35 and 55. And severe retardation is between 20 and 40. And now, profound retardation is with an intelligence quotient of less than 20. Between 71 and 84, the subject is considered borderline. It's considered to have borderline intellectual functioning. So maybe they can take care of themselves, but they're right there in the borderline. And they're not probably considered mentally retarded, but they're considered with a quite low intelligence. So they're in the borderline between normal or non-retarded and retarded. And someone that has an IQ of 2 standard deviations above average, which is 130, well, those people are considered gifted or geniuses. Being considered mentally retarded has some important implications because when we cover disorders developed during childhood, the DSM-5 gives us the criteria that mental retardation has to meet some of the symptoms in order to be diagnosed as such, and usually one of those symptoms is an IQ score of lower than 70. Now, when it comes to comparing how smart countries are, there have been some people that have wanted to do this, and they have compared which countries have a higher IQ than others, and some of their conclusions have been quite quite nasty, because some people have derived some racist conclusions from this. But before we get to that, so let's take a look at the IQ differences worldwide. As you can see, when people have taken IQ tests, those living in East Asia or China, Mongolia, Japan, Korea, and so on, and people living in Western Europe and North America, they have the darker shade, so they have the highest IQ. And the lowest IQ are the one or people living in sub-Saharan Africa. Now, this is a map provided by two famous psychologists who studied this, Lin and Van Hanen, studying IQ differences across the world. Now, this has been very, very controversial, very much as the book that I mentioned a few minutes ago, The Bell Curve, because some racist conclusions have been drawn from this. The fact that the IQ in sub-Saharan Africa is quite low, and it's between 75 and 80, and remember that according to our previous definition, that would be a borderline intellectual functioning. So what these results suggest is that people living in sub-Saharan Africa are in the borderline between normality and being mentally retarded. Some people have drawn some very racist conclusions for that. And it is also, it's never, I mean, these results are true, and the interpretation of these results may be quite another thing. And, you know, we may criticize the nature of the tests, and we may criticize the interpretation, but it is a hard fact that when IQ tests are provided, people in sub-Saharan Africa, on the whole, as an average, there are always exceptions, of course, but as an average, they tend to score lower. Now, this doesn't only apply to populations in sub-Saharan Africa. It also applies to black populations in the Americas and Europe. So the IQ of those populations is lower than other racial groups in those countries. So it is a fact that blacks in America, African Americans, have a lower, on the mean, on the whole, have a lower IQ than white populations. And the same goes for European countries. Now, from this data, some people have gathered a racist interpretation. So they have claimed that blacks are genetically not provided with genes for intelligence. And of course, there have been some very nasty political implications from this, arguing that, well, if blacks are intellectually inferior because it's in their genes, then maybe they shouldn't have the same rights and so on. And in fact, for many years, this was how it was, how slavery and segregation in the United States, to a certain extent, were justified by claiming that, look, we cannot let blacks be free because they just can't take care of themselves because they're not intelligent enough. So, and it's because you know, they don't, it's because it's already in their nature, it's in their genes. So no matter how much education we give them, they will never be able to succeed because it's in their genes that they are not given for achievement. Of course, I mean, this offends a lot of people, and this also offends me. And there are many criticisms of these views. First of all, we may dispute whether or not race is a meaningful concept. I mean, when these results are divided by race, and they say, well, black people have this score and white people have this score, that the division between being white and being black is very arbitrary. Because as you physicians may probably be aware, as students of human nature, I mean, maybe the concept of race applies well to other species, such as dogs or cows or horses, but when it comes to humans, applying racial differences or divine the human species according to racial lines, it's very difficult to do. So first of all, race may be a meaningless concept when it comes to the human species. Now, a second critique could be also that the social factors are relevant. So, I mean, even if it is true, and indeed it is true, that people in sub-Saharan Africa or that black populations score lower than white populations in America, it's not necessarily due to genetic factors. I mean, it may also be to the fact that these people have been socially marginalized, well, because of slavery, because of colonialism, because of segregation and so on. So if blacks in America don't have access to the same schools as whites in America do, and if there is a segregation in school, and if the state of schools in black neighborhoods are not as good as white neighborhoods because they don't have the same funding, well, that will eventually influence significantly a difference in IQ in both populations. Now, bear in mind that these are social differences. These are not biological differences between the populations. So in that case, I mean, the racist interpretations are not accurate. And there's also the concern that these tests don't really tell us much. IQ tests have been criticized for some reasons that we'll cover shortly. But if IQ tests have been criticized, then that may tell us that, okay, yes, maybe people in sub-Saharan Africa have lower IQ when it comes to these IQ tests, but so what? I mean, these tests don't really measure intelligence. And if these tests really don't measure intelligence, then someone with lower IQ doesn't necessarily imply that that person is really less intelligent than someone with higher IQ. So let's take a look at some of the criticisms of IQ tests. Well, first of all, there's a criticism that this test places too much emphasis on cognitive aspects. Now, remember the theory of multiple intelligences. They claim that there are various types of intelligences. And one of their criticisms of IQ tests is that it just places too much emphasis on the cognitive aspect of intelligence, basically the logical, mathematical dimension and the verbal and communication dimension. But the other dimensions, such as interaction with others, musical ability, or even sports ability, which also requires intelligence, those dimensions are not taken into account in IQ tests. So maybe they don't really measure intelligence as a whole, but only a very specific part of it. There's also the problem of cultural biases, and these biases have to do with the fact that they may ask questions that resemble too much or that reflect too much the cultural conditions of any given country. So, for example, if I ask someone in let's say in Haiti, which by the way has a lower IQ score when compared to other countries in the Americas, if I ask someone in Haiti, okay, tell me, complete this sentence: Jesus is to Christianity what Muhammad is to. Now, someone who may go to school in the United States, they'll probably know that the answer here is to Islam, right? But someone in Haiti who has never been taught about Islam, who has not had access to schools because of the poverty over there and the earthquake and many of the tragedies that Haiti has gone through, well, that person will not be able to answer this question. Now, that doesn't necessarily mean that that person is less smart than the others. Or that genetically he's inferior when it comes to intelligence. No, it's just that the culture doesn't really the culture that person is inscribed in doesn't really match with the question that he's being asked. So this is an example of cultural biases. Now, there have been some attempts to correct some of the cultural biases. So they have designed new IQ tests so that they will ask questions that are not too biased in terms of one culture, but that someone from any given culture could answer. So, for instance, one of those attempts is what's called the Raven's progressive matrices. So you see some of the matrices over there. You see the black square on the left. Now it's on the right. Now it's on the bottom right. So in the next image, where should it be? Well, it probably should be on the bottom left, right? So, I mean, the idea here is that anybody from any culture can answer the correct answer. If they have a minimum level of intelligence, they can answer. They can choose the right answer in these questions, and that they are free from cultural biases. So let's take a look at some of the most commonly used tests when it comes to measuring intelligence. There's the Welsh-Learned Adult Intelligence Scale Revised Test, and this is the most commonly used IQ test. It basically tries to test general information, comprehension, similarities, arithmetics, vocabulary, picture assembly, picture completion, block design, object assembly, digit span, and digit simple. So one of the I looked on the internet Wechsler Adult Intelligence Revised test, and some of the examples that come up are, for instance, some bargles are chungos. Now you may ask, what are bargles? Well, they're hypothetical things, but what they're really measuring here is the formal thinking, how you use logic. So some Bargos are Chongos and some Chongos are Monhatsens. The question here is, are some Bargos definitely Monhatsens? It could be, yeah. Not definitely, because it could be. It doesn't necessarily have to be that way. So the question here, I think, would be no. They're not definitely Manhattan. They could be, but not definitely. Or another example: what is 1/4 of 1/10 of 1/2 of 100? Well, this is a logical mathematical dimension. So to answer this, I think we should answer backwards. So first of all, what is 1/2 of 1 of 800? It's 400. And what is 1/10 of that? So 1/10 of 400 is 40. And what is 1/4 of 40? Well, 40 divided by 4, it should be 10. So the answer here is 10. So these are the types of questions that come up in these tests. And as you can see, they measure numerical and logical abilities. Okay, now apart from intelligence as such, there are also other tests that try to measure the social maturity of individuals. And one of the more famous one is the Vineland Social Maturity Scale. So this test tries to evaluate skills for daily living in mentally retarded people and other challenged people. So for instance, those with impaired vision or hearing. So in the case of mentally retarded people, once they have been given an IQ test and they score lower than 70, because remember 70 is the line between mental retardation and non-retardation. Once they have been diagnosed with a mental retardation, well, psychologists could apply to them the Vineland Social Maturity Scale, which measures their functionality, their level of functionality, and their level of skills required for everyday living in mentally retarded people. So the skills measured in this test are, first of all, communication skills, general self-help ability, locomotion skills, that is to say how they move, occupation skills, how well they can do some tasks, self-direction, self-help eating, can they eat on their own, self-help dressing, can they dress on their own, and socialization skills, are they able to have relationships to other people. And here's an example of the Vineland Social Maturity Scale. As you can see, there are some of the items that are being measured. Remember that these are people with mental retardation or some forms of impairment when it comes to vision and hearing. And it tries to measure, well, how well they can integrate themselves and how well they can live on their own. If they have a high score, well, that means that they are able to live on their own. If they don't have a high score, then that may require some guardianship from other people. Okay, apart from that, there are also achievement tests. And achievement tests, they measure how well an individual has mastered specific subject areas such as reading and mathematics. Later on, we'll take a look that the DSM-5 categorizes some disorders that have to do with learning. So for instance, dyslexia is a disorder that has to do with difficulties in reading. So how do you find out whether or not someone has difficulties in reading? Well, applying achievement tests. And there are also other disorders that have to do not just with difficulties in reading, but for instance, difficulties in handling numbers. So there's a disorder in the DSM-5 that, as far as I remember, I would have to check, but as far as I remember, it's called dysnumeria. This disorder is basically difficulties in handling basic mathematical relations. So how do you know if these people have these patients or these potential patients have these disorders? Well, one way of finding out is by applying some of these achievement tests. Now, they can also be applied for career counseling. So if someone is undecided about what career they want to follow after they graduate from high school, these tests allow them to decide in what area they have greater chances of achieving. And not only that, but also how much it corresponds to their vocational inclination. So, I mean, you may have a lot of knowledge in chemistry, but maybe you just don't want to be a doctor because in order to be a doctor you have to cope with a lot of stress and so on. So career counseling is not career counseling tests are not just about in what area you're more likely to succeed because of your knowledges and academic strengths, but also considering how well it suits your vocation. And I think this is quite important when it comes to students of medicine because, as you probably know, you future physicians are a lot of you are under pressure from your parents or your relatives, and especially if there is another doctor in the family. And there's a lot of pressure on youngsters such as yourself in order to become doctors. And that's really no good. I mean, if a student, even if he has the potential to be a good doctor, if the student does not want to be a doctor, then I don't think the student should be pushed. Now, these tests, to a certain extent, allow the subject and the subject's relatives to know whether or not they are well suited for any given profession. To a certain extent, the USMLE is also an achievement test. There, they will measure whether or not you have gathered enough knowledge in order to become a physician. When it comes to achievement, the wide range achievement test, or as it is known, WRAT, this is quite known in psychological circles, and that's probably the test that it's most frequently used. It's quite used clinically, and it is the test that is mostly used when it comes to evaluating arithmetic, reading, and spelling skills. Okay, so far we've taken a look at objective tests that measure both intelligence and achievement. Let's take a look now at personality tests. Now, personality tests are concerned with the evaluation of psychopathology and personality characteristics, and they tend to be more subjective than the achievement and intelligence tests. And remember, when they're subjective, they're more projective. So it's not that there are right or wrong answers to any given questions, but rather questions that the person who's applying the test has to interpret. So let's take a look at the first one. The first one is the Minnesota Multifaceted Personality Inventory. So this is an objective test. There are 566 true or false questions, and they are very concrete questions asking you very specific questions regarding your state of mind, and there are scores depending on how you score that can evaluate depression, schizophrenia, or what in the DSM-4 used to be called hypochondriasis, but now it's called it's called illness anxiety disorder. Now the test is very long because it also allows you to check whether or not the person who's taking the test is telling the truth. So there are trick questions to make sure that the subject is not lying. And it's also sometimes used to check whether the person is faking feeling bad or faking feeling good. So someone may say, "Doctor, I feel great. There's no need for you to diagnose me as someone that's depressed." But then if they take this test may actually reveal that that person is not really feeling as good as that person is claiming. So some of the examples that are given in these true or false situations is, for instance, I avoid most social situations. So the person answers either true or false, or something like, I certainly feel worthless sometimes. Well, again, the person may answer true or false there. Now, a more controversial test, because it's far more subjective, is the Rorschach test. Now, you've probably seen this, and you probably know what I'm talking about because it's quite famous in the media. I mean, it's all over the movies and TV series when a doctor shows a patient some ambiguous images, and the patient has to figure out what's going on in those images. And it's basically a projection of their state of mind. So depending on what they project, well, the doctor may not necessarily make a diagnosis, because in order to make a diagnosis for a mental disorder, that requires a little bit more of scrutiny, and there are some more specific criteria in the DSM-5, but it could be a first hint as to what the state of mind of a given patient or any given subject is. So it's a projective test to identify thought disorders and defense mechanisms. It has been heavily criticized because of its subjectivity and arbitrary interpretation. As you can see in this slide, those are the images. There are only 4 of them here, but it's about, I think there are about 20 images that are shown in a Rorschach test. So basically, the psychiatrist or the psychologist or the counselor shows one of those pictures to the patient or the subject, and the patient just begins telling what they see there. So, for instance, in the bottom left here, people usually see a bat. But depending on the description they give of the bat, or if they see something entirely different, then there are various techniques that we won't have time to cover them right now. But there are various different techniques for the psychologist or the psychiatrist to interpret the different answers that the patient is giving and projecting on each one of these images. Now, as I was saying, this Rorschach test has been criticized because it may be just too subjective. I mean, just because someone gave an answer on a specific image that they have, the way they perceive a specific image, and that's not absolutely guaranteed or sure that may mean a personality trait, or even less so a disorder, a mental disorder. So unlike other tests, this test has been quite open to criticism, well, because of its ambiguity when it comes to the results. Very similar to the Rorschach test is the thematic apperception test, or TAT. Now, in this case, they're not abstract images. They're rather 30 drawings depicting ambiguous situations. But I mean, you can actually see what's going on. So there you see a woman or 2 women there, whereas in the previous slides of the Rorschach test, I mean, you're not really sure what they are. They're just, stains on a piece of paper. Here, you can actually see the picture, but you require the patient to tell stories after taking a look at the picture. And those stories need to have a beginning, a middle, and an end. So depending on how they tell the story, the psychiatrist or the mental health practitioner can gather, first of all, the level of mental sanity that the person may have, and also some of their personality traits. So, for instance, I recently applied to some students these 2 slides from the thematic apperception test, and here the one on the right. You can see a little boy over there and someone with a knife opening up someone's body. Now, I got 2 very different interpretations of this story. One student was telling me that someone got in the house and there were some thieves and they were robbers and they were killing one of the persons there in order to rob them. Whereas another person was telling me that someone had appendicitis and they called the next door neighbor, and the next door neighbor came over here and they did an immediate surgery in order to save that person's life. Now, I mean, very loosely, I could say that the first person may be a little bit more disturbed, or maybe more of a pessimist, whereas the second person is not as disturbed, is more of an optimist. Now, this is a gross simplification, a gross overgeneralization, but it serves the purpose of illustrating how these projective techniques work. Okay, there is also the sentence completion test, or SCT as it is known. This is also a projective test, but it's a little bit different because here the patient is not being stimulated by images, but rather by words. So it's basically about completing sentences. So for instance, one of the sentences is, I am scared of, and then you may answer that, well, monsters or thieves or diseases or aliens and whatever. I wish that there is world peace. I wish that my neighbor dies. I wish that the Yankees lose, and so on. Well, depending on how people complete those sentences, the psychiatrist and the psychologist, they may be able to identify some worries and problems. So this is a more useful test than the previous 2, I think. And I think that most psychologists and psychiatrists would agree with me on this one. Okay, now when taking a look at the tests, it's always important to keep in mind how reliable and valid they are. If we have time to cover this if we have time for a lecture on epidemiology later on, we'll develop this point with a little bit more of detail. But for now, it suffices to know that reliability of a test is the ability to measure a given trait consistently. So for instance, retest reliability is how well an initial administration of a test correlates with a repeated administration. So if you give someone a test and they have a score, and a few months later you give those same people the same test and they have the same score, then you can tell that that test is reliable. It's not volatile, and that's a well-designed test. Now, reliability is not the only quality that a test must have. It must also have validity, and that is the degree to which it is measuring what it says it is measuring. And there have been some concerns with intelligence quotient tests regarding validity. IQ tests are reliable. I mean, when people take IQ tests and they have a score and they take them again, they usually get again the same scores. In that sense, they're reliable. But a lot of people have criticized their validity because, as I was saying, maybe IQ tests are not really measuring what they claim that they're measuring. Maybe they're measuring something else, but they're not really measuring intelligence. So when a test is really measuring what it claims to be measuring, then we can say that the test is valid. So for instance, how do we know whether or not a test is valid? Do the depressed patients score higher on the depression scale than a group of inpatients with another mental disorder, with schizophrenia? So if we have some patients that we know for a fact that they are depressed because of other symptoms, and it turns out that when they answer those tests, they don't come out as depressed people, we may say that that test is not really valid because it's not measuring what it's claiming to be measuring. If that test is claiming to measure depression, but then those people that are depressed actually turn out to score, they turn out to have a score that does not reflect depression, then we cannot claim that that test has validity. So in order for doctors to apply some of these tests, they should have both reliability and validity. Okay, and let's cover as our last point psychiatric evaluations. Now, when psychiatrists talk to patients, they have to take, say, psychiatric history. So they have to gather information regarding their mental illness, drug and alcohol abuse, sexual activity, and sources of stress. And psychiatrists also have to perform on their patients a medical status examination. So in this case, the psychiatrist evaluates the patients on a set of variables. First of all, appearance, behavior, and attitude towards the interviewer. Now, all of these items, all of these criteria will tell the psychiatrist. It will be an initial screening of what the patient's state of mind is, and if they have a mental disorder, well, this may be a first indication. So first of all, evaluation covers appearance, behavior, and attitude. If someone is too aggressive, or someone is very dirty, or someone has some very strange behavior, that may be a first sign of for further studies. Psychiatric evaluations also cover levels of consciousness, orientation, memory, attention, cognitive, spatial, and abstraction abilities. They also cover language, so they gather volume, speed, articulation, and whether or not they have some language deficiencies. Also their emotionality, so described and demonstrated emotions are also covered in these psychiatric evaluations, and also the match of emotions with the current events. If you're a psychiatrist and you're doing an interview and then you come to realize that the patient's emotions don't match with the current events, then that may be a sign of schizophrenia. That's one of the negative symptoms of schizophrenia, which is called flattened effect, and that is a mismatch between emotions and current events. It could also cover form or process of thought content. So, for instance, whether or not patients have delusions. This is also very important when attempting to diagnose schizophrenia. Psychiatric evaluations also gather whether or not the patients have hallucinations and illusions, and whether or not they're reliable. This may come when trying to diagnose someone, whether or not someone has an antisocial personality disorder, for instance. And finally, whether or not they are in control of aggressive and sexual impulses. So all of this stuff can be gathered in a psychiatric evaluation. Now, it could be the fact that the psychiatrist does not have a lot of time to perform a screening of the patient because of the emergency or any other given circumstances. So there are some psychiatric examinations that can be performed very quickly on a patient in order to make an initial screening. So, for instance, a patient in these mini mental examinations, they're called mini mental state examinations. The first skill to be evaluated is orientation, and that is asking the patient what day is it and where are you. If they score correctly, and then they have a score of 10. Another question is regards language. So you would show them an object and you could ask them, okay, tell me what this object is. If they answer correctly, they get a score of 8. If not, they get a score of 0 regarding that question. Another skill, attention and circulation. So you would ask them to subtract 7 from 100 and then continue doing so. So 100 minus 7, 93, minus 7, 86, minus 7, 79, minus 7, 73, and so on. If the patient manages to do this correctly, then he gets a 5. You can also evaluate registration. So you ask them to repeat the name of these 3 objects. So you mention them and you tell them to repeat after you. If they are able to do it, then you give them a 3. And also recall. So after 5 minutes of having done the previous question, you ask them to repeat the names again. And if they're able to do so, you again give them 3 as a score. And the last skill to be evaluated in this brief examination is to copy a design. So you show them on a design and you ask them to copy a very simple design, of course, either a square or a circle or a triangle or whatever. And if they're able to do it on a piece of paper, then you give them a score of 1. Now, after you have performed that test, the maximum total score, which I assume that all of us here in this classroom would have, because we're all, right now, I am assuming we're all totally mentally capable. A maximum total score would be 30, so I'm assuming that we would all get 30. Now, a total score that is less than 25, according to the scoring guidelines that I just presented, that suggests cognitive problems. And a total score of less than 20, that suggests significant impairment. So that may be a reason for concern and further study. And according to DSM-5 criteria, it's a recommendation for the patient to be referred to for further studies in order to make a right diagnosis. Okay, so that should wrap up our lecture for today. Before we conclude, let's do 2 questions that resemble the ones that will appear in USMLE and that have to do with the topic of today, which is intelligence, achievement, and personality tests. So, a child is tested and found to have a mental age of 12 years old. The child's chronological age is 10 years. So, what is the IQ of this child? A, 40, B, 60, C, 80, D, 100, or E, 120? Well, remember that in order to calculate the IQ, we divide mental age by chronological age and we multiply it by 100. So in this case, it will be 12 divided by 10. It will be 1.2 times 100. It will be 120. So the IQ of this child is 120. So this is above average, but it's not yet to the level of being gifted. Remember that gifting is 2 standard deviations above the mean, and in this case it's 130. And so someone with 120 has higher than average intelligence, but it's not intellectually gifted. Out of these 5 options, option A and option B, 40 and 60, would be considered mentally retarded. And of course, option D is average. Okay, let's take a look at another question. Okay, so today we'll continue with another lecture on our topics of behavioral science or behavioral science course. So far we have covered ethics and psychology of development, and we've also covered some basic psychological theories, psychoanalysis and behaviorism. Today we'll cover an entirely new topic, which is intelligence, personality, and achievement. And this has to do with the field of psychology that's called psychometrics, and that is to say how to measure things, how to measure psychological traits. Now there are many psychological traits to be measured. They can be personality traits, but they can also be intelligence. And U.S. physicians should also be interested in the way psychiatrists measure some of the traits in their patients. So psychology, although it's part of the human sciences or the so-called behavioral sciences or social sciences, and it's usually considered a soft science in comparison, let's say, to physics or chemistry, psychology, out of all the social or human sciences, is probably the one that's closest to a positivist way of thinking. That is to say, a paradigm that tries to measure stuff quantitatively, that is to say, with numbers, and not just a mere interpretation. So as a psychologist, you have to gather data, and in order to do so, well, you have to follow some methods, and we'll cover some of those methods here. That is to say, the way that tests are designed in order to recollect data to test intelligence, personality, and achievement. So keep in mind that all this stuff will come up in the USMLE Step 1, and as soon as we finish this lecture, we'll go on to review all the contents that we have covered today by taking a look at some of the types of tests that we'll be taking a look at. Now, apart from that, we can also make other divisions of tests. There are objective tests, and these are based on questions that are easily scored. And these are mostly used in intelligence and achievement tests. And there are also projective tests, and these are a little bit different. These are a little bit more used in personality tests. These are tests where the subject interprets questions, so it's a little bit more difficult to have a precise answer as to what is the right or wrong answer. Whereas in objective test, there are more right or wrong questions, so it's easier to figure out what the level of intelligence or achievement with someone is. When it comes to personality, it's a little bit more difficult to do. And when it comes to psychopathology, well, I would say it's somewhere in between. I mean, some items are objective, some other items are more projective. So, you know, it's the middle ground between objectiveness and subjectiveness. We can also divide tests according to how precise they are regarding the individual that takes the test. So there are individual tests, they are more precise, or there are also group tests, and they are less precise, but they're easier to administer. So usually group tests are the ones kind of like the USMLE, when people go into a room and they're given paper and pencil and they have to answer a set of questions. Whereas an individual test, it's the tester sits with the subject and they go through each question, so more attention is given to the individual. The results are expected to be more precise. So individual tests are more precise, group tests are less precise, but they have the advantage that they are easier to administer. Okay, so let's begin by taking a look at intelligence tests. Now, from the beginning, this is a little bit tricky because psychologists do not all agree on what intelligence exactly is. And there are quite a number of controversies regarding this topic because, as we will see, it has some political implications and also some racial implications when it comes to racial relations, not only in America, but also in other countries, but of course, especially in America. Because, as you probably know, race is a much bigger problem in America than in many other countries in the world. In Latin America, race is not as big as a problem, and race relations are a little bit more harmonious than in North America. But for the time being, we'll define intelligence as the ability to understand abstract concepts or reason, to assimilate, recall, analyze, and organize information. So intelligence has to do with cognitive abilities, and that is to say, how does your mind process information? And it's not just about memorizing information, although that may be part of it. It's also about how you process the information. I mean, once you have the information, how can you solve problems? So intelligence can be about facts, about remembering facts, but it can also be about applying those facts to specific situations and reasoning. Now, as I was saying, this is a controversial concept because we're not really sure what intelligence is. And when it comes to intelligence, there are basically two theories in psychology regarding intelligence. First, there are those psychologists who believe that intelligence is a real thing and it's a real unified thing, and that there is such a thing called general intelligence, and that all those intelligence tests, they measure what in psychology is called the G factor. Now, the G factor is supposed to be an underlying capacity that individuals have, and that capacity, that underlying capacity, allows them to succeed in any other area of academic achievement. So the proponents of this G factor theory claim that there is a tendency for people who do well in one area to also do well in another area. So those of you that pass the USMLE, well, it's quite likely that when you were high school students, you were not just good in chemistry or in biology. It's very likely that you were also well behaved, that you had good behavior, good civic behavior, and that also you were good at math and probably at geography or history. Now, of course, I mean, in high schools all over the world, those who get A's in one class, that doesn't necessarily mean that you will get a high grade in another class. I mean, there have been many cases when people get an A in physics and maybe an E in chemistry. But that's usually not the case, or at any rate, the difference is not as big. Because according to this theory, if you do well in one class, well, it's because you have a generalized intelligence that not only allows you to do well in that class, but should also allow you to do well in every other class. And that's called the G factor. So the G factor is generalized intelligence that allows people to exceed, basically, to succeed in all areas of life. Now, this has been disputed by other psychologists who, as opposed to this theory, they propose what's called the multiple intelligence theory. And basically what this theory claims is that intelligence is not just an underlying ability that covers all areas. You may do very well in one area, but that doesn't necessarily mean that you're smart in another area. And according to this theory, there's not just one generalized factor, there's no G factor, but actually there are many intelligences. So this is called multiple intelligence theory. And in their estimation, intelligence can be divided in various dimensions. So first of all, there is a musical rhythmic dimension. So these are people, let's say, like Beethoven or Mozart or Chopin or Michael Jackson or Elvis Presley. These are people who have a great ability to, incorporate sounds and make artistic creations with music. Answers, or I'm sorry, some of the review questions that are very similar to the ones that have appeared in the USMLE Step 1 in previous editions. Okay, so let's begin by taking a look at the different types of tests that are used in psychology. First of all, there are intelligence, achievement, personality, and psychopathology tests. So intelligence tests, well, they are the ones that measure how intelligent someone is. Now, as we'll see later on, intelligence is a tricky subject because there are some people who think that intelligence is just too complex to be measured, or that at any rate there are many dimensions to intelligence, so it's not so easy to just put them in a test. But nevertheless, there are many psychologists who do think that testing intelligence is possible, so we'll take a look at that a little bit later on. The same goes for achievement. This is more of academic achievement, so there are some tests that are designed to study how well an individual does academically. And to a certain extent, the USMLE Step 1 is a type of achievement test. Now, of course, it's a very specialized type of test. It's just designed for medical students. Achievement test is more generalized. But nevertheless, I mean, you get the idea that the purpose of an achievement test is to gather data about how academically consistent or how academically prepared someone may be. There are also personality tests. These are a little bit more controversial because they're more open to criticism, in as much as they are not as objective as the other tests. So we'll take a look at them later on. And there are also tests that try to measure psychopathology and, trying to get around how normal a patient may be, or how pathological he may be, and what may be some of the disorders that those symptoms express. So those are the four